My name is Arleen Messer, and I know many of you are terrific dental patients. You go to the dentist every 6 months, get your teeth cleaned, get them checked, chat with the dental hygienist and the dentist. But I also know that many of you, even just thinking of the dentist, a lot of negative emotions come up. Maybe because you fear the dentist, or there's mistrust or embarrassment. But today I do want to show you some new concepts in holistic dentistry. It can be a crucial part of your total health and well-being. And it can even help overcome the obstacles that keep people away from the dentist, away from the care that they might need so desperately. So in holistic dentistry or biologic dentistry, we look at the mouth as the gateway to the digestive and respiratory system. It's affected by our immune system, and it can be driven by our nervous system, and so on. Our treatments benefit more than just the teeth and the gums. The goal that we have is for the whole body to be in a harmonious environment. We carefully examine each patient's unique health history. We look for clues as to each and every patient's individual needs. We try to use non-toxic, biocompatible, natural, minimally invasive techniques whenever we possibly can. Our focus is on diet, habits, prevention, and education. And as I mentioned, the therapy is targeted for each and every individual person. Everybody is very different. It's certainly not the paradigm that I grew up with, the drill and fill dentist on the corner. And to show you what I do as a holistic dentist, I'm going to help you understand the most common dental conditions and what to do about them. So, in trying to be the healthiest we can be, how do we start? We start by changing the way that we think. And I'm going to tell you a story. This is a true story. There was a world-renowned psychiatrist by the name of Henry Cotton. He was the head of the New Jersey State Lunatic Asylum, as it was so improperly called, but it was. And he was a very, very enthusiastic and forward-thinking psychiatrist. He even was the first to institute the removal of restraints from the mental patients. He also instituted morning huddles for total patient care. He was very devoted to his practice. Sounds great, right? He was progressive. He began to follow an emerging medical theory, which was that infection in distant parts of the body can pollute the brain or any other tissues or organs. It was a new theory at the time. It was in the 1920s. And the idea has some merit, but he took it to the extreme. And he essentially experimented on his patients. He took his patients to the operating room and began removal of their teeth, ovaries, testicles, colon, stomach, whatever, all in hopes of curing his patients of mental illness. Now, as I said, this is a true story. He exaggerated his success rate. He said he had an 85% success rate, when in fact 45% of his patients died, and the rest were left mangled and maimed in a pursuit of a cure that never, ever existed. He even pulled out some of his own teeth when he suffered a nervous breakdown. And so you could have gone into the hospital with depression and come out with no teeth. So I tell this story, this cautionary tale, because it's vitally important that as patients and doctors, we need to do our research, we need to keep an open mind, and not blindly believe whatever we read or hear. The internet contains a lot of erroneous information put out there by well-meaning bloggers and individuals without sufficient research, sufficient documentation. We need to embrace change if evidence proves that we are wrong. Knowledge is a process that is always evolving. You know, holistic dentistry asks patients and doctors to respect traditional methods, but also to think about new ways to treat disease and other health conditions. So many of our long-held concepts, especially in dentistry, have been proven to be ineffective and wrong and possibly toxic to our patients and to the environment. As an example, the silver fillings that are probably in some of your mouths today have polluted, quite a large percentage of them have polluted our environment. There is mercury, which is a neurotoxin in our environment, due to silver fillings being placed and removed. And this practice still being endorsed today. Not in Europe, they do not allow it in Europe anymore, but here in the United States it is. JFK said, law changes the law of life, and those who look only to the past or present are certain to miss the future. So in biological dentistry, we honor the past, and we live in the present, but we think a lot about how we're going to improve the future of dentistry. Oftentimes, improving the future involves learning from the past. There was a dentist by the name of Dr. Weston Price. He practiced in Cleveland in the 1930s. He is a hero of mine. He was interested in nutrition. At that time in the 1930s, it was very progressive to think about nutrition and how it relates to disease and dental decay, physical degeneration. He took it upon himself to travel the globe and study indigenous tribes that had no inroads from Western civilization. In 1930, he published a book, a very important book, which I have here, called Nutrition and Physical Degeneration. The book concluded that the modern Western diet, particularly flour and sugar and modern processed vegetable oils, caused nutritional deficiency and decay. The dental issues he observed included severe overcrowding of what we now consider what we need orthodontics for, and rampant dental decay. After presenting his findings, he actually invited others in the scientific community to critique and review his research. Unlike Dr. Cotton, he welcomed people to critique his work. He kept an open mind. So what's important to all of us, or what should be important to all of us? To stick with the same old routines that may or may not work. We have to, as I said, have a more open mind to dental health. One of the things we need to start changing about is the way that we think about a very particular disease, the most common disease worldwide. The most common disease worldwide is dental decay. Many times I hear patients say they regularly visit their hygienist and their dentist, they brush, they floss, and they still get cavities. They even start to doubt the dentist and feel like maybe we're making something up. For years they're scolded and say maybe you're eating too much candy, with drill and fill being the only option at the time. Maybe you know somebody who said, you know, I'm not going back to the dentist, they always find something. It could be that there's more to it than that. Dental decay is preventable. And how do we know that? We know that because of Dr. Price's work. Although we've made so many advances in dentistry, we still see a lot of dental decay. It has not been eradicated. So before we can talk about how to fix it, we have to know what it is. So what is tooth decay anyway? Tooth decay is an infectious transmissible disease. I'm going to repeat that. It is an infectious transmissible disease. It is caused by bacteria, and it is fueled by sugar. You did not inherit soft teeth. You were given the gift of this bacteria from whoever, from your siblings, your mom, boyfriend, girlfriend, whoever. It's transmitted mostly into family groups, which is why the whole family, if somebody has a cavity, the whole family needs to be treated with preventable measures. The disease of dental decay is a process. It's not a one-time event. Our mouths are home to multiple strains of bacteria, both good and bad. The good bacteria produce an alkaline environment which protects our teeth. The bad bacteria produces an acidic environment which breaks down the enamel. It erodes sculptures. This is acid rain eroding sculptures made of stone. It works the same way in our teeth. And since our bodies are looking to operate in perfect balance, there is a system in place to protect our teeth, and it's called saliva. Our saliva comes rushing into our mouth when we're eating and removes food debris, deposits minerals back into the enamel, protects our teeth from acid. This acid versus saliva cycle is called demineralization and remineralization. It's happening all the time, even while you're eating your lunch. Sometimes this cycle is out of balance, and the process tips towards demineralization, meaning the breaking down of your teeth. The acid that the bacteria produce and some of the foods that you eat and drink destroys your enamel, and that's called a cavity. What causes the shift and disrupts that balance? Disrupts the harmony of the saliva protecting the teeth. For one, it is lack of saliva. This is a very big problem for a lot of people because saliva contains the minerals that harden the teeth. It contains buffering agents that neutralize the acid, contains antimicrobials, which kill the bacteria, and cleansing liquid, which washes away food debris. Any reduction in saliva will make you much more cavity prone. This condition where we don't have enough saliva is called dry mouth or xerostomia. And it can be caused by many different things, but most commonly medication. Anybody take medication? Hundreds of medications cause dry mouth or xerostomia, even over-the-counter medications, as well as prescription medications. Symptoms of dry mouth would be dry lips, burning tongue, difficulty swallowing, bad breath. You don't have saliva to wash away the food debris. Nothing to deposit minerals back into your teeth. Nothing to combat the acid that is breaking down your enamel. And the next thing that causes that shift from remineralization to demineralization, the primary cause of cavities, is sugar. We've all heard it. We've heard it from the dentist since we were little, but we all have a weakness for it, unfortunately. So it causes a lot of problems. Sugar, as I mentioned, feeds the bad bacteria, but so much more. So much more. Our friend Weston Price, the dentist, discovered even more effects when sugar is introduced to the diet. As I mentioned, he traveled the world, went to isolated groups in remote locations, and he saw a radiant wellness in these indigenous cultures, these indigenous populations. He found straight teeth, no decay, physically strong and healthy bodies were the norm. Now, you have to understand, he looked at he took thousands of photographs, volumes of research that showed no decay, straight teeth. And he dug up thousands of skulls, no decay, straight teeth. As soon as inroads were made into these populations, soon as a railroad came in, because remember, they were isolated. Soon as a railroad came in, they traded their goods. They traded their goods that they produced for our sugar, flour, marmalade, and jelly. And within one generation, this is what happened. It's alarming. This is 20 years. Only 20 years. Total breakdown of their teeth, overcrowding of the arches, malformed shapes to their face. So Dr. Price concluded that this dental decay, malformed dental arches, is actually a symptom of what is happening in the rest of our body, physical degeneration. So if there's one thing I would like to get for you to get out of this presentation is the primary causes of decay: bacteria, sugar, and acid. So think of it like termites infecting your house. Your house is infested with termites. The house will keep breaking down unless we get rid of the termites. Same thing in our mouths with decay. As long as the bacteria is there, we're going to keep getting cavities. So we have to get rid of the termites, we have to get rid of the food and the environment that they thrive in, and then we have to repair the damage. So now that we know how decay forms, we need to think about what we're going to do. But do teeth even matter? I know that's a dumb question, but I have many patients come in and they tell me, just take out my teeth. I'm just tired of, drilling, and just take them out. So when I say it's a dumb question, maybe, maybe not. So you may have heard the story of a waiter who was left the best tip ever when a customer offered to pay for his dental work. Obviously, probably changed his entire life. The next slide is a patient of mine, Carol. She was only 31 years old, told me her favorite food is fried chicken. But she hasn't been able to eat a piece in 7 years because she cannot chew her food. So there's the obvious physical discomfort, but there's also a heartbreaking psychological toll, as well as affecting nutrition and your entire immune system. So patients with extreme decay don't eat the things they love. They learn to smile without showing their teeth or don't smile at all. And they feel the social stigma attached with having decayed teeth. Carol told me she felt like a hillbilly or a redneck, passed up for jobs. Patients, and again, express extreme frustration. They keep getting their teeth drilled and filled with the pain, expense, and time that goes along with it. This is actually a beautiful young lady, hard to see. Of course, we don't have her face. We worked hard to fix her teeth and to remove decay. And every single visit, we talked about diet. Every visit, how diet affects teeth. And one of her last visits, she came in and set this on the counter. This is a bottle about that big of Powerade. And she saw the look of horror on my face, and she said, "Oh, it's not that bad. It's not soda." So there seems to be a desperate need for us to really understand what we're eating and drinking. Nutrition counseling would be a great idea. These are things a holistic dentist cares about. That's why we talk to patients about this. The first step in protecting our teeth, risk factors. How likely are you to get a cavity? So here are some factors. We'll talk about visible decay or decay noted on an X-ray, orthodontics, cavities within the last 3 years. That's a biggie because if you've had a cavity within the last 3 years, it makes you much more cavity prone. Infrequent dental visits, poor oral hygiene, high sugar, flour products, and dry mouth. Also, frequent snacking. When you're grazing all day long, you've got acid in your mouth all day long. And smoking as well. And my patients sometimes think I'm really strange when I ask them to spit into a cup for me, but I find out some really interesting things. With salivary tests, we assess the pH of the saliva. Is it acidic? How about the bacteria? Do you have the bacteria that's causing your cavities? How much of it do you have? What type do you have? How about yeast overgrowth? Yeast contributes to dental decay. And buffering capacity. How well can you fight those acids? So, and then when we have the results of the saliva testing, we make recommendations for each and every person. Everybody's condition is very different. So what are some very inexpensive, simple things that anybody could do to protect their teeth? Remember, we talked about risk factors. Well, for people at low risk for decay, we just recommend simple: brush your teeth, visit the dentist, don't have a lot of sugar. For moderate to high risk people, there are some changes that really do need to be made. So some of the things we'll recommend is balancing your pH. We're trying to get rid of the acid, an acidic environment that the bacteria thrive in. Some of the things we can use and recommend is baking soda toothpaste. Arm & Hammer makes it. Simple, not expensive. Hard cheese. Hard cheese neutralizes acid. Only a half an ounce of hard cheese after breakfast or after snacking neutralizes acids. resulted in significantly less cavities. There is a product called Alka-Thyme mouthwash, which I have here. It is alkaline, and it has anti-inflammatory and antifungal, and also it has oil of thyme, which is natural, which is also naturally antibacterial. There's a new product, which is great. It's called Basic Bites. These are mints. You have it 2 times a day, and again, they change the environment of our oral cavity. We also need to fight the bacteria. How are we going to kill bacteria? The bacteria that are causing the cavities. We can use ozone gas. Believe it or not, we're using ozone in dentistry today. It's very safe and very effective for killing bacteria. There's a specific toothpaste. Some of that information may be in your packet, but it is up here as well, because you can't remember all this. Colgate, Sensitive Pro Relief toothpaste. It's a newer one. It has arginine, which is natural. Again, arginine is there to fight cavities. We can use something called a neem stick or neem toothpaste. Neem naturally prevents colonization of the bacteria. And it was traditionally used on the Indian subcontinent, where the people are very impoverished. They don't even have a toothbrush or toothpaste, and this works very well. You can use baking soda, as I mentioned before. You can use it in a water pick. Very effective, very inexpensive antimicrobial. Iodine. Iodine is very, very safe. It's been used in dentistry for over a century. It's a very powerful antimicrobial, very simple to use in the dental office. We take a swab, swap it around your teeth, you spit it out, done. Cow's milk, believe it or not, milk, if you can't have it, has lactose, it has calcium, it has phosphate, casein, all of which inhibits cavities. And get ready for one that might really surprise you. Sodium hypochlorite. Sodium hypochlorite is otherwise known as Clorox bleach. We use it in a dilute solution. It is very effective, very powerful, and very safe. Again, used in dentistry for over 100 years. There's a product called Dakin solution, or we have one here called CTX4. These are dilute solutions of sodium hypochlorite. We only use this in patients who have rampant decay. Remember, we're trying to reset the balance of the oral environment. Some of these things are used under supervision, but they're very effective. And saliva. We want to increase our output of saliva. Remember, it's that magic liquid that we use that's used to protect the teeth. So we need a healthy flow of saliva. And saliva in between meals will dip by tenfold, meaning when you're eating or snacking or drinking, your saliva output is 10 times what it is in between meals. So if you are susceptible to cavities, we want you to have a healthy flow of saliva throughout the day. So that's why we're going to recommend some products that will help you stimulate salivary flow. And again, we realize now how important it is. So you avoided sugar, you fought the good fight against decay and bacteria and acid. How do we repair the damage and strengthen our teeth? Well, your teeth need to be remineralized. The outermost shell of enamel is the hardest substance in the entire body, but that acid breaks it down. So the remineralizing agents that we're going to use, MI paste, and that's it's through dental offices. It's made from milk derived from calcium and phosphate. Very safe, very easy to apply, and safe for all ages. Hard cheese and milk, once again, for remineralization. And there is something called bentonite clay. It is a natural product. It has many, many minerals. You can get it in the health food store online, and I believe we might have given you a recipe for bentonite clay toothpaste. Very natural, simple to make, and it will remineralize the teeth. So now you're all experts on decay, more than you wanted to know, probably. But can you tell me what is the leading cause of tooth loss in the world? Tooth loss in the world. It's not decay. It is periodontal disease. It is gum disease. Maybe some of you have been told you have gum disease. What is it? It is a plaque-induced inflammatory condition. And this one can really affect your overall health. As with many diseases, it starts out slowly, insidiously, and snowballs after that. It can begin very simply with bleeding when you floss and brush your teeth, or maybe your gums look a little red. Well, this is called gingivitis. And this is the start, this could be the start of periodontal disease. And it can advance to periodontitis, which means inflammation around the tooth. In periodontitis, the gum pulls away from the tooth and forms spaces called pockets. And those pockets become infected. The body's immune system fights the bacteria, and the plaque spreads and grows underneath the gums. And so the body's natural response to these toxins and the inflammation is what breaks down the teeth and the tissue, the bone and the gums that hold the teeth in place. The teeth may then become loose and have to come out. Once you're diagnosed with gum disease, it cannot be cured. And that's important. It cannot be cured. It can only be managed and maintained. Interestingly, many people suffer from some form of periodontal or gum disease, but they don't think anything of it. If you brushed your hair and your scalp started to bleed, I think you'd be pretty alarmed. Well, many people that brush and floss that see blood in the sink say, hey, no big deal. But bleeding gums are a very big deal. Why do we brush and floss? We try to brush and floss to get rid of plaque. Plaque is a biofilm. It's natural. We all have it. It's made of bacteria that attach themselves to the smooth surface of our teeth. It's a normal process. But when we leave the plaque on our teeth by not brushing and flossing, it develops into a nice thick layer. Ever get the feeling that you have like sweat socks on your teeth? So that's the plaque. The bottom layer begins to ferment our food that we are eating. And that causes irritation of the gums and the breakdown of our bone and tissue. It's a regular brewery in your mouth, really, the fermentation process. And as you know, if you've been to a brewery, fermentation causes some very odd smells. Periodontal disease has a very distinctive smell. These are very different strains of bacteria than what cause cavities. These specific microorganisms leach into a host's lymphatic and bloodstream and can reach distant organs, causing an immunoinflammatory response. Scientists have found links between periodontal disease and some very serious health conditions, such as heart disease, diabetes, Alzheimer's, rheumatoid arthritis, and premature birth weight. Returning to our friend Dr. Cotton, his treatments were based on that theory, that infection in other parts of the body can move to distant organs and tissues. Well, after a 70-year hiatus, this theory has come back into medical favor because of evidence showing that periodontal disease is linked to some very serious diseases. Well, while we're not going to cut out your colon, we now see how crucial management of periodontal disease is. So your bone and your gums are the very things that are holding your teeth in place. It's kind of like the foundation of your mouth. I don't know much about construction, but I do know if you try to build a building on sand or in wetlands, that structure isn't going to be very stable. It's going to be a constant battle to keep that foundation strong. Well, the same with periodontal disease. I can make the most beautiful smile, I can give you veneers, I can whiten your teeth and take care of all the decay, but if you've got periodontal disease, it's all going to be lost. It's going to be lost. The foundation is weak. The most important thing we can do is to prevent it from ever happening. And as I mentioned before, once a diagnosis of periodontal disease is made, it cannot be cured. It can only be managed. So some of the risk factors: smoking. If you need another reason to quit smoking, here it is. Smoking is one of the most significant risk factors associated with the development of gum disease. Additionally, it lowers the chances of successful treatment. Poor nutrition and vitamin deficiencies. Age. Diabetes. People with diabetes are at higher risk for developing infection, including gum disease. Medications. Not enough saliva Remember, we talked about how medications can reduce the output of saliva. Without enough saliva, tooth is much more vulnerable to infection. And then there's the genetic susceptibility, unfortunately. Some people are just more prone to gum disease. So here's what you can do to prevent it. Diet. Since periodontal disease is an inflammatory condition, our diet should be anti-inflammatory. The recommendations that we made for cavities is the same that we're going to make for periodontal disease. Brush and floss twice a day. Remember, you're removing the soft plaque that's around the teeth. An antiseptic mouthwash like Alka-Thyme. We're going to try to increase saliva flow. Again, inadequate flow helps perpetuate periodontal disease. We know that CoQ10 and vitamin C deficiencies have been known to be precursors to gum disease. And stress. Stress causes everything, doesn't it? Well, stress is found to be significantly correlated with gum disease. And the more stress you have, the more severe and widespread the disease will be. So if you've been diagnosed already, what are some new things that we can do? And so most importantly, and this is not a new thing, but most importantly, the thing that you can do is regularly attend your 3-month periodontal maintenance visit. It is not a cleaning. And I'm going to repeat that, it is not a cleaning. We're disrupting that biofilm, the thin layer of bacteria, causing the breakdown of the bone and the gum. And you have to understand how strong this microscopic layer is. These bacteria are so tightly formed together and now stuck on the teeth and get under the gums. And unless it is physically removed by the dental hygienist, you cannot remove it with all the mouthwash in the land. It has to be removed with an instrument. 90% of that biofilm is removed by the hygienist going underneath the gum tissue. So it takes 3 months for that bacteria to recolonize, and that's the idea behind the 3-month periodontal maintenance visit. I was reading a very serious research paper the other day, and I thought it was funny that the researcher said, these bacteria multiply like hell. I've never read anything like that, that a researcher actually said that. So I'm going to suggest that you see a physician, because periodontal disease can be a result of autoimmune or immunosuppression. And a physician can be a very important part of your overall therapy. Reduce your stress, yoga, meditation, mindfulness training, lifestyle changes. Ozone gas, we talked a little bit about it before. Ozone gas is used to kill those microorganisms, and we place it in the pockets around the teeth. Iodine, we're doing the same thing. When you're in the dental office, we'll place iodine in the pockets around the teeth. A stream of iodine kills the bacteria within 30 seconds. It's very safe, as I mentioned. We mentioned also sodium hypochlorite, which is bleach. And that's used for a short period of time, maybe about 2 weeks, killing the microorganisms. Again, trying to reset the balance. Probiotics, mint therapy, probiotic mints. They displace this aggressive periodontal bacteria with neutral, non-harmful bacteria. Coconut oil pulling has been used in India. It's an Ayurvedic remedy. Pulls out the toxins. It's antiviral, antifungal, anti-everything, and very easily available, very simple to do. You're pushing, pulling it through your teeth for 5 minutes, then you spit it in the garbage. Always remember, periodontal disease, as I mentioned, is non-curable. Crucial to manage it by coming in every 3 months, but 50% of it is your home care, cleaning your teeth. So some new directions in holistic or biologic dentistry. We try very hard to use the most current diagnostic tools possible so we can diagnose problems before they become more complex. Some of the other therapies we use are CT scan. CT scan is an invaluable tool for the detection of bone cavitation, bone infections that we cannot see on a regular X-ray. It's also very useful in planning implants. This is a sleep apnea appliance called a Somnodent. And we do sleep disorder screening. With the mouth being the beginning of the airway, dentists are in a prime position to help the medical community in diagnosing and treating sleep apnea. See, sleep apnea causes some very significant health problems, high blood pressure, stroke, heart failure, many things. Another new method and concept that we use, well, have been using, not so new for us, is saliva testing. This is Saliva Check that we use. And these are the strep mutans, which is the bacteria before and after. As you could see, the other slide has no bacteria. And this is after some of the protocols that we recommended before. So this verifies what we did is working. This is another type of bacteria, as you can see, before and after the anti-cavity protocols that we recommended. So even when the cavity is detected, so we have the capability also of arresting decay. And we have the capability of actually healing a tooth, so we don't have to drill and fill. This is called IKON. This is a new restorative material. We can kind of do this filling without drilling your tooth. It's what we call a starter cavity. We can heal it with this process, so we don't have to drill your tooth to fill it. Again, new concept. Inlays and onlays are not new, but we really love them because they're very conservative. In the past, we had to drill down the whole tooth to make a cap. I don't know if you're familiar with that. Here, we just are removing the decayed portion or the weaker portion, and we just restore it with porcelain. And now we have safe amalgam removal. These are amalgams. You're probably familiar with that. And in our office and in holistic dental offices, we use the safe amalgam protocol removal. Our fillings are made of 50% mercury. As I mentioned, it's a neurotoxin. When it becomes, when we drill it out, it becomes vapor. It becomes aerosol. Well, as I said, it's a neurotoxin. We do not want that floating around in the air. We don't want it for the patient. We want to protect the patient. We want to protect ourselves. So we utilize something called the safe amalgam protocol technique. We use a huge Hoover vacuum called the dental air vac unit. We use drapes, and we use something called a rubber dam, which is that purple thing. Where's my patient? Yeah. So we do a lot of protection because we drill out a lot of fillings every day. That's the dental air vac unit, and that's the protocol. So another thing that we utilize is ozone. Ozone, as I mentioned, is a newer concept. It's been used to disinfect swimming pools, fruits and vegetables, laundry. It's now being utilized in dentistry for the sterilization and disinfection of teeth. And we use it to kill bacteria that cause gum disease and decay, as I mentioned before. It stimulates our immune response and is an anti-inflammatory agent. And it is simple and it's not invasive. Zirconia implants, I don't know if anyone is familiar with dental implants. If you're missing a tooth, perhaps you are. In the past, we used titanium implants, which have an incredible track record. Very safe, biocompatible, but today we have zirconia implants, which have no metal, biocompatible, more aesthetic. So we are now utilizing zirconia implants. Well, just as we have to change our way of thinking regarding dental conditions, I believe we also have to change, as dentists, the way that we interact with patients. Helping patients overcome their fears, anxieties, is essential for healing. Many modern dental practices today have sedation, from nitrous oxide all the way to IV sedation. We also can provide little comforts like blankets, pillows, TV, essential oils, aromatherapy. And overcoming anxiety, it allows those patients to get the help that they need before their issues become more time-consuming, more complex, more expensive. And this type of holistic practice concept addresses something that is so important in the health process and so often overlooked, the mind and the spirit. So, action plan. So we've covered a lot of information here. It's been very dense. I apologize for that, but it's so important. So I'm sure you want to know, what am I going to do with all this information that I've provided for you? Well, we're going to ask that, well, I'm going to say that a lot of the work is in your own hands, unfortunately. Can't come home with you. So we're going to ask you to become educated, proactive, being your own advocate. The road to being healthy involves change and lifestyle change sometimes, as we all know. Changing daily habits, but the payoff is you're going to feel better. You're going to spend a lot less money. And you're going to have much less pain and aggravation. So you're going to determine your risk factors by having a full mouth assessment. A dentist can determine what your risk for periodontal disease is. Is it high? Is it medium? Is it low? And then we can make recommendations. Once you know your risk factor, you as the patient can make your choices. If you're high risk for cavities, as we talked about before, some changes are going to be necessary. You have to think about that sugar. Have saliva, have diet analysis. You're going to brush twice a day and floss, removing the plaque and the biofilm that we talked about. And for God's sake, get a Sonicare toothbrush. A Sonicare toothbrush removes plaque and bacteria like nothing else. It'll feel like the hygienist cleaned your teeth every time you use it. So, regular dental exams, of course, detect conditions in their infancy. So we can use the minimally invasive approach. So we can use the IKON, so we don't have to drill and fill. We're going to ask you to have a healthy diet so that you have the proper vitamins and prevent nutritional deficiencies. I recommend, why not get a baseline consultation with your physician? Many people are deficient in vitamin D today and many other things. So what kind of toothpaste should you use? As we talked about, Arm & Hammer makes a great baking soda toothpaste. If you feel like you want to be a little wild, you can get some neem toothpaste, which is really excellent, anti-inflammatory. For your children and yourself, just remember the bacteria causes the problem, and the sugar feeds the bacteria. You have to involve the entire household in preventative measures. So let's go back to Dr. Cotton for a moment. And what if you were in the state mental asylum, strapped in for one of his wild surgeries? And what if somebody busted through the door and unbuckled you and set you free? Well, I feel that way about holistic dentistry because it's a break from the rigid paradigm that I was trained in. We have tried to have open minds. We have a very collaborative approach. We work with a lot of other healthcare professionals. Our emphasis is on patient education and participation, and it helps us from repeating the mistakes of the past. So with so many options on dental care being strongly voiced by people on TV and the internet, it becomes hard to separate fact from fiction, especially when endorsements come from so-called experts. So instead of being drawn into extreme camps, familiarize yourself with the concepts I've presented today. Be flexible in your thinking. Know what's happening in your mouth. Become part of your own healing process. Join me in looking forward to where holistic dentistry is going to be the norm instead of the exception. So, thank you.